Hello everyone, welcome to AY Tutorials. Today we are exploring one of your body's key arteries, that is carotid arteries. It may sound technical, but understanding it can change the life. So without wasting our time, let's get started. What are they? The carotid arteries are the major blood vessels that supports or transports the oxygen-rich blood from the heart to the brain and head. These carotid arteries, these are the major blood vessels which are located in the neck and that supplies the oxygen-rich blood to the brain, face, and neck. Then location, there are two carotid arteries, one on each side of the neck. They arises from the aorta and travel upward into the internal carotid artery, which supplies blood to the brain, and the external carotid artery, it supplies blood to the face and neck. Then function, these arteries, they are essential because they supply blood to the large front part of the brain, which is responsible for the critical functions such as thinking and speech, personality, sensory and motor functions, means the ability to feel and move. Then vertebral arteries, a smaller set of arteries, are located in the back of the neck and they supply blood to the back of the brain. Then, understanding the carotid artery disease. Definition: carotid artery disease is the narrowing or the blockage of the carotid arteries due to the plaque backup. Here, the carotid artery disease, it occurs when the carotid arteries becomes narrowed or blocked due to the buildup of fatty deposits, which known as a plaques, and this condition can significantly reduce the blood flow to the brain and increases the risk of stroke. There are certain symptoms which includes in the early stages carotid artery disease may not present any symptoms. However, it can lead to the serious conditions as such as transient ischemic attacks or strokes, which may manifest as sudden numbness, weakness, trouble in speaking, or severe headaches. Here I have mentioned atherosclerosis and plaque composition. Atherosclerosis is the process of plaque buildup which is known as the atherosclerosis, and it is the same condition that causes the coronary artery disease and peripheral artery disease. And plaque composition, in that plaque is a deposit of cholesterol, calcium and other cells that forms on the artery walls. Then risk factors. The slow buildup of the plaque is caused by the several modifiable risk factors, which includes high blood pressure, diabetes, then tobacco use and high blood cholesterol. Risk factors that increases the risk of developing carotid artery disease includes high blood pressure, high cholesterol, smoking, diabetes, obesity, and a family history of cardiovascular diseases. Let's understand the dangers of the carotid artery diseases. Stroke mechanism. Over the time, the narrowing of the arteries can become so severe that it decreases the blood flow to the brain, which can typically lead to the stroke. An alternative cause, a stroke can also occur if a piece of plaque or a blood clot breaks off from the carotid artery wall and travels to the smaller arteries in the brain and blocking them. This carotid artery diseases, it can cause a stroke due to blockage in the brain and also known as the ischemic stroke. The blockage cuts off the blood supply to the part of the brain and killing the brain cells, and the effects of the stroke, it depends on where it takes place in the brain and how big the damaged area is. Ischemia and infarction. Brain cells needs a continuous supply of the oxygen and glucose from the blood. When blood flow is blocked, the cells are damaged. This is nothing but the ischemia, or die due to the infarction. Leading cause of strokes. According to a National Stroke Council, more than half of strokes in the United States are caused by the carotid artery diseases. Here I have mentioned the difference between ischemic events and stroke. Ischemic event, when a blood flows to the brain is blocked which results sometimes called an ischemic event, and this can be a stroke or a transient ischemic attack. And stroke means a stroke is a permanent loss of brain function due to a lack of blood flow that lasts for more than a few minutes. The permanent brain damage can occur if the lack of blood flow lasts for 3 to 6 hours. Transient ischemic attack. A transient ischemic attack is a temporary alteration of the brain function with the symptoms that can last from a few minutes to the 24 hours but are not permanent, and it is often called as mini stroke. And warning sign, it includes a very powerful warning sign for a potential permanent stroke and should always be treated as a medical emergency. Symptoms. There are often no warning signs for early carotid artery disease. For many, a TIA is a first sign, symptoms of a stroke or transient ischemic attack are similar and may include blurring, dimming, or loss of vision, tingling around the mouth, difficulty with the speech, inability to move an arm or leg, numbness in a part of a body, and a sudden severe headache. Then, diagnosis. The diagnosis is typically based on an ultrasound examination of the neck arteries, which is known as a carotid artery duplex scan. And alternative methods includes the artery can also be visualized using a magnetic resonance angiogram, that is MRA, or a standard angiogram. Treatment options. Goals. The treatment focuses on normalizing the risk factors using medication and, in some cases, procedures to open a narrowed arteries. Then, medications. Healthcare providers often prescribe daily antiplatelet medications like aspirin or Plavix to reduce the risk of developing blood clots. Prevention is a key. Taking control. The best medicine is prevention. It is up to the individual to take all the possible steps to reduce their risk. Then, preventive measures. Maintain a healthy lifestyle with regular exercise and proper nutrition. Take all prescribed medications from your doctor as instructed, and take with your healthcare professionals if you have any risk factors for carotid artery disease. Then, seek help immediately if you experience any symptoms of the stroke or TIA. Do not hesitate to delay seeking medical attention. Minutes are critical in preventing permanent brain damage. Here we are done with the carotid arteries diseases. If you like this video, please like, share and subscribe to the AY tutorials. Thank you.